You will.
All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. See, now you're happy. We are doing our last of the day, actually last of the night. We always save the best for last. Our beautiful client who really just wants texture improvement in her skin. We are working to do a combination of treatments. We are doing microneedling radiofrequency with Pixel 8. This is one of my favorite in terms of microneedling and deep microneedling for texture of the skin. So this is really going to help her irregular complexion. And actually, Jordan, if you don't mind, can you show that before picture that we had that she sent in? And I love these.
This is what we're up against, guys.
I love these. I know we're in a mission against these scars. So I really like when people send in the selfies with the side lighting and sort of outdoor lighting, because it really shows how they see the scars. When I look at her, it's actually not as bad as in some of the photos. So it gives me an idea of where I really need to focus, which is why I'm doing a little bit stronger with the microneedling radiofrequency right now on this cheek area, and really focusing on the a little bit more in the deep depth, because her scars are more of that cobblestone nature is what I call them. It's a mix of sort of boxcar and ice pick scarring mixture there throughout the entire cheek area. So we are going to combine the microneedling radiofrequency with CO2. So we're really going to be going deep. Now she's going to feel a little bit more here, then it'll be a little less as we move out.
People want to thank you for sharing your procedures.
Oh, that's really nice, actually. It's very nice that they're saying thank you to you. They're not saying thank you to me, by the way. They're saying thank you to you. And so
people are commenting on her brows. They say they're on point.
They say, she is on point, you guys.
Yeah, they like your brows.
They like you. You guys, my patients are always on point, okay? Point out all the good things.
So is it the same as Morpheus 8?
So it's very similar in terms of it in being in the technology range of what we're doing, which is microneedling radiofrequency. They all have their pros and cons. This one having a little bit more higher delivery of energy in each initial pulse. And I just find that people see more of a result more quickly. Now, here's the issue, you guys. Some of these devices, so that side's done. Excellent. So let's turn this way. Some of these devices in the right hands get amazing results, and some do not. So you have to be really careful about who you go to and how you do these treatments. It's rare for microneedling radiofrequency to cause an issue, but it's still possible.
Does Dr. Emer do subcision? Yes, he does, all the time.
Yes, she doesn't need it, actually, but it definitely is something we could do for scars, depending on what we're trying to do. Turn all the way to the right for me. A little bit more. I'm going to turn your headlight.
Are you ever coming back to South Florida? I missed you in December. We're going to be back in... Someone's asking about us being in Florida.
Yeah, we'll be
in
Florida.
They missed us. We'll be there October 20th to 22nd.
She was just asking about excision versus subcision. So subcision is when if you smile and the scars don't come together, then you may be a candidate for subcision, because the bands are holding down the scars. They don't move when you move your face. Excisions, when the scar is really deep, it's going to take many lasers, if any at all, maybe can't even work. Then we have to cut them out. Hers are not so bad that we need to do that. I really think the majority of hers is irregular texture, or what I call texture irregularities, and that's going to be a combination of energy devices. Sometimes we'll actually use even filler like Bellafill, which is our long-term filler, to kind of plump them a little bit.
Right, people want to know, do you use the Liberator?
I do use Taylor Liberator. Yeah, we can use it. Depends on who needs it. It's very aggressive, though. In the old days, we used to do that. We're 3/4 done on the side. Okay, turn a little more to the right. There you go. We just got to get through these couple of lines.
People are recommending names of other doctors you should train.
Okay, that I should train?
Yes.
Well, they're welcome to email PJ at jasonmrmd.com and set up training with me.
We're not going to say names,
but I would say, like, you guys want to come to see me, come see me. You guys know we've done a lot of lives here in New York. We've done lives obviously everywhere else, but in the New York ones we've done so far, we are actually posting updates daily on our stories, you guys. And Jordan, how's everyone doing?
Everyone's doing great right now. They're peeling, they're scabbing.
Skincare protocols from Emer Cosmetics, that's the key. Our patient here did prep with a peel, so that was great. I know she did it because Lindsay, our coordinator, ran out in the middle of the night to go over do the peel with her virtually. So that was great. She left dinner for you, which I love. That's dedication right there. That's real love.
Someone said, get this man a cold diet Dr. Pepper.
Oh, you know I love that. You guys know I love Diet Dr. Pepper. It's my favorite. Who said that, actually?
That was Allison.
Okay, thank you, Allison. So you guys look now, this is perfect. So now we basically have done what we need to do for the microneedling RF. We're almost done.
Someone said I did Pixel 3 times, Morpheus 3 times, Erbium, I still have issues. What should I do next? Come see us. You most likely need a combination treatment. So send us a DM, full name, email, and phone number.
Yeah, the majority of times I find that when people are not happy or satisfied with the results, it's because they didn't do a combination, they didn't do skincare pre and post. So you guys take a look now. This is normal. Just want to make sure we're not missing any spots. There's a couple little areas. I'm sorry, honey.
How are the results different from this procedure versus microneedling with PRP as the vampire facial?
So that is not going to improve your scars. That's perfect. That's
very
not going to
different.
improve your scars. That's going to make your skin glow, and it's going to give some improvement in texture and tone, but it's really not going to help the scars. So what we're going to do now is we're going to put some more numbing on her, and then we're going to go into our ablative resurfacing with CO2. So hold still. We'll be back. All right, put a little more numbing on. Yes, go ahead, yeah. I'm going to do it with the CO2.